Many patients with knee problems walk into the clinic for the first time, not knowing their fate. The vulnerability that comes part and parcel with being ill or injured may make one nervous or apprehensive about the new environment they may be walking into. So to gain a better understanding of the thoughts, feelings, and concerns that patients may have before attending the knee clinic for the first time, we spoke to a few patients about their individual experiences. While most had a pleasant experience at the knee clinic, expressing that they received much better care than they did at their primary care hospital, others expressed their general anxieties that they had regarding their knee condition and how it was affecting their daily life. Some expressed fears that they would never walk again. Some were afraid that the pain and discomfort they were in would never go away. Some explained that their knee problems were affecting their daily activities like climbing stairs, while others were anxious about the probability of an amputation. Therefore, in this video, we want to address the concerns and fears that you may have going into the knee clinic. We will depict what it is you can expect to find during your consultation, the types of questions and special tests and special investigations the doctor will ask and do, and we hope that the video will give you a general idea of what you might expect from the knee clinic. Your doctor will typically take a short history of whatever may be bothering you. In the interview, the doctor or orthopedic surgeon may inquire about any other illnesses, such as hypertension, diabetes, or thyroid disease. They may ask you about your background and social history, like your age, where you live, your occupation, smoking, and drinking habits. They may ask how your knee problem is affecting you daily and how it has affected your daily functioning. It is therefore important that you are honest with your health professional, as any little piece of information you give them during the interview may count for or against various diagnoses and treatment options. If you have knee problems, you may complain of pain, loss of function, struggling to get up from a chair or out of a car, not being able to walk long distances or to climb upstairs. You may have a limp, swelling or locking of your knee, or you may have injury or may have had trauma to your knee. Some patients may be already known to the clinic with chronic illnesses that may affect their knees, such as arthritis, gout, malignancy, and certain genetic diseases such as osteogenesis imperfecta. Once the history taking has concluded and the doctor is satisfied, you will move on to the physical examination. In the physical examination, the doctor will perform various tests to clinically determine what the problem is with your knee. The physical examinations are usually quick and non-invasive and aim to align your signs and symptoms with a differential diagnosis. You will be asked to expose your knees and to walk across the room. The doctor will then inspect your knees to exclude any visible signs and deformities, to feel them and palpate them, and perform various exercises and techniques in order to adequately determine what the problem is. The examination may feel uncomfortable and may be painful, especially in the already painful knee, but the exam is quick and non-invasive. The doctor may also examine your hips, feet, and spine to exclude any additional problems and to make sure that the pain in the knee doesn't stem from elsewhere, like the hip or spine. Special investigations. To gather the information that was found clinically and to make an adequate diagnosis, the doctor may require more tests. These often include imagery to take pictures of what is happening inside the knee. This includes an X-ray or MRI of the knee. Other special investigations include ultrasounds, knee aspirations, or just having your bloods drawn. The type of special investigations ordered by the doctor differ from case to case, but X-rays are the standard test that is done. Once the doctor has gone through the investigation results, they can then decide on what management may be appropriate for you. Management. Contrary to popular belief, surgery is not the only outcome of a visit to the clinic. Depending on the severity of your disease or injury, there are simpler, more conservative methods that can manage your condition. The doctor will discuss your options with you, and a joint decision will be made as to how best to manage your condition. The aims of management are therefore pain control, correcting anatomical derangement, and improving overall function of your knee. Should your knee pathology require non-operative measurements, the following options are available and will be discussed with you by your health practitioner: a heat or cold compress, different exercises or walking aids, physiotherapy, occupational therapy, and pharmacological treatment such as a steroid injection or analgesia for pain control. Should you require an operation, the risks will be discussed with you by your doctor. Your doctor may discuss a total knee replacement or a revision thereof if you've already had one, a patella abscess drain, a synovectomy, a washout, or arthroplasty. These procedures will be discussed with you by your doctor, as well as the risks and benefits involved with such a procedure, who will be performing the procedure, and when you can expect to have the procedure done. Post-operative management typically requires physiotherapy and rehabilitation. One may be referred to a physiotherapist for rehabilitation and the use of walking aids if necessary. We hope this video was able to give you a glimpse into what you can expect from the knee clinic. Should you have any questions or concerns, please do not hesitate to ask your doctor. Thank you for watching, and we hope your experience in the knee clinic is a good one. Good luck, and we thank you.